Number of immune checkpoint drugs are being used in solid tumors and showing very exciting results. So this is one of the first studies to look at the applicability of these drugs in a large number of patients in acute myeloid leukemia. And we combine azacitidine, which is a standard approach for these patients, with nivolumab in salvage therapy. So most of the patients had prior treatments. The median was 2 prior treatments, and the endpoints of the study were both overall response rate, which included CR, CRI, and PR, as well as durability of response and overall survival. What we saw was that the overall response rate was about 35% with the combination of AZA and nivolumab, which compares favorably to an expected historical response rate of about 15 to 18% for similar patients with azacitidine or decitabine alone. More importantly, the ones who got a response maintained a very durable response, and we're doing a number of correlative studies now that are actually showing that patients who had a high CD8 or a high CD3 population in the bone marrow were much more feasible to respond versus those who had low T cells to begin with did not respond. And also with treatment, those who are getting a response, the T cells in their bone marrow are going up with time, as would be expected with a favorable immune infiltrate, as opposed to those who have no response where the T cell numbers stay the same or drop. So it looks like the clinical and correlative aspect of this study are matching well, and what is really encouraging is the 30-35% who have a response. The response has been very durable with the median duration about 9 months and ongoing. So we think this is quite exciting, and we're now expanding into the frontline setting and potentially combining it with other checkpoints such as nivolumab with Ipilimumab with azacitidine.